Hello students, my name is Robert Szymczak. I'm an emergency medicine specialist working at the Department of Emergency Medicine of the Medical University of Gdańsk and also helicopter emergency medical service in Gdańsk in Poland, and I will present you a seminar concerning emergency procedures. So we are going to go through the eFAST ultrasound protocol, needle cricothyroidotomy, surgical cricothyroidotomy, needle thoracostomy, tube thoracostomy, pericardiocentesis, emergency thoracotomy, sclerotomy, and resuscitative hysterotomy. So let's start from eFAST ultrasound protocol, which is the most popular protocol used by the emergency physicians at pre-hospital care and at emergency department. The acronym eFAST means Extended Focus Assessment with Sonography for Trauma, and this protocol is dedicated for the trauma patient. So what are the indications for eFAST? So first of all, it is indicated for urgent imaging diagnostics for the abdominal cavity and the chest, and especially it helps in the diagnosis of the life-threatening conditions in the patients who are unstable after trauma, and this trauma concerns abdominal cavity and chest. What is the aim of eFAST? So first of all, the FAST examination, the aim of this examination is search for fluid in the abdominal cavity, pelvis, and pericardial sac. So the only FAST is checking the fluid in those three cavities. eFAST, this extension of the eFAST, is the examination of the lungs, so searching for the fluid, which in trauma patient means blood, searching for it in pleural cavities, and also searching for pneumothorax. So actually you can diagnose the most life-threatening conditions using eFAST in trauma patients. What are the pros and cons of this examination? So when it comes to advantages, it's very quick examination. In good hands, it takes like 60 seconds to perform whole examination. If you know where to put the transducer, what to look for, it will take you around 1 minute. It is non-invasive. You can repeat it, so you can reassess the state of the patient. That's another advantage. And it has very high sensitivity and very high specificity. And remember that it detects the presence of fluid from the volume of 250 milliliters, so it might be advantage or disadvantage. But if you see the fluid, it means that it's at least 250 milliliters. What are and the aim of this examination is not to diagnose which organ is ruptured, for example, like is it spleen or liver, the source of bleeding. The aim of this examination is to check if there is blood, and it's enough for you to, let's say, decide where is the bleeding and what kind of surgical procedure the patient needs. What are disadvantages? So first of all, it's not used to identify a damaged organ. Okay, so do not waste time thinking about which organ is damaged when you perform FAST. It's quite difficult to perform, especially the lung examination, when there is surgical emphysema or gastrointestinal distension or obesity. So if the anatomy of the patient does not help, it might be more difficult. And when there is surgical emphysema, then there's also a problem because the air in the subcutaneous tissue interferes with the views and possibility to view the organs of the abdominal and thorax cavity. And you will not be able to exclude or confirm the damage of the intestines, diaphragm, and retroperitoneal bleeding. So The FAST it's not invented to diagnose the injuries of intestines, diaphragm, or the bleeding into retroperitoneal space. What kind of acoustic windows we've got in the FAST examination? We've got 4 windows. So it's the right upper quadrant window, subxiphoid 4 chambers view, left upper quadrant view, and the pelvic view. So we've got 4 views. So 4 places where you put the transducer and search for the view. So let's start from the first one. So the right upper quadrant view. You can use or convex or phased array transducer. I'm working at Helicopter Emergency Medical Service, and we've got 1 transducer, and we have chosen to have phased array transducer. So we use this one, but you can use also the convex abdominal probe. So you put a probe in the right mid axillary line around 7th to 9th intercostal space. And if you've got problems with visibility and the patient is conscious, you can ask the patient to inhale. Then the organs will be, let's say, pushed under the rib cage, and it will be easier to see them. And ultrasound examination needs some, let's say, you have to move the probe, so you can move the probe looking for the best view. And to check the pleural cavity, you just move the probe forwards. When it comes, every transducer has a marker. So when you use the phased array transducer, you should have the probe's marker upwards, okay, towards the head of the patient, as on this picture. And this view will show you the liver and the kidney and hepatorenal recess, which is called Morrison pouch. Okay, so the Morrison pouch is visible here. So that's the place where you would look for the fluid. And here you've got normal view without the fluid. And you can also check, if you move the transducer upwards, the right costodiaphragmatic angle in the search of any fluid in the pleural cavity. So here you've got an example of the normal view, and here you've got an example of the fluid in the Morrison pouch and over the liver. The fluid is hypoechogenic, so it's black. So when you see the black area between liver and kidney in the trauma patient, you should think that there is blood, so there's some organ damage in the abdominal cavity. And if the patient is in shock, probably it's due to hemorrhagic shock due to trauma in of the abdominal organs. Here you can see the fluid. So here we've got kidney, here's the liver, the diaphragm and lung, and the fluid in this costodiaphragmatic angle. Okay, on this film, you can see the kidney, the liver, the position of the probe. As you can see, when you move the probe, you can see different parts of the kidney and liver. So you put it in the axillary line, the marker upwards, and you can see the kidney, the liver. That's the array of the ultrasound. So if we want to visualize different parts of the kidney, different parts of the Morrison pouch, you just move the probe. Okay, and here is the Morrison pouch when you would look for the blood. And as you see, the ultrasound is quite a movable picture. Liver, kidney. Okay, if you want to see the pleura, you just move it upwards, and then you see the pleural cavity. And if there would be the fluid, you will find the fluid there. So here we've got this the diaphragm and the place where you would look for the fluid in the pleural cavity. Okay, so that's the first view, the upper quadrant, right upper quadrant view. The second view, so we just move to the left of the patient, is Subxiphoid 4 chambers view. You can use or convex or phased array transducer as as before. So we put a transducer at the subxiphoid position with the prop marker to the right side of the patient. Prop should be in the direction to the left shoulder, so direction of the prop is to the left shoulder, and it should be 50 on the 50 degrees angle from the abdominal surface, so as you can see on this picture. And what you can see on this view, so you can see 4 chambers. So here we've got liver, and here we've got right ventricle, right atrium, left ventricle, left atrium. So you can observe in the FAST examination we focus on or any fluid and in the precardial sac. So here you can see this hyperechogenic part is the precardial sac, okay? Here we've got muscle, and the hypoechogenic, so black parts are chambers. Here you can see the fluid and the precardial sac, okay? So if you've got the patient with penetrating trauma and you see fluid around the heart, you should consider the heart tamponade as a problem. So 4 chambers and precardial sac in this view. So as you can see here, all those 4 chambers. So on this film, you will be able to observe where to put the prop, okay? You will be able to assess also the contractility while you perform this examination. So it also helps to detect, for example, cardiogenic shock. Okay, so the marker towards the right side of the patient, but then you move the prop into direction to the left shoulder, 50% angle. So left shoulder, 15% angle. So that's the perfect position of the prop to find the acoustic window. Of course, if the patient is obese, it's a little bit more difficult to get. Sometimes you have to really push the tissues. And as you see at the upper part of the image, we will have the liver. Then you've got the precardial sac and heart, and the first chambers will be the right ventricle and right atrium, okay? And then you will have left ventricle and left atrium. Okay, so that's the anatomical view. Here we've got precardial sac, this hyperechogenic structure. And as you can see on this picture, we've got good contractility of the left ventricle. Okay, the next view is the left upper quadrant view. It's very similar, like symmetric view to a right upper quadrant view. So we can use those two transducer or convex or phase array transducer. You put the transducer in the left posterior axillary line, so a little bit to the bed, okay, and a little bit to the head in the 5th-7 intercostal space in comparison to the right upper quadrant view. So it's called, like, just to remember, when you go to the left side of the patient, to the bed and to the head with the prop. You can ask the patient, as before, to inhale if it's possible for the better visibility of the organs, and to check the pleural cavity, you have to move the prop upwards. The prop marker should be towards the head of the patient. And what we can see here, you can see the spleen, you can see the kidney, so instead of liver, you see spleen, which is smaller. You can see the kidney, and you see the splenorenal recess, which is called the collar punch, and also left costodiaphragmatic angle. So here we've got spleen and the kidney and the diaphragm, and here we've got collar punch, and on this picture you can see the fluid or blood over the spleen. It can also be, some pictures can be observed in the collar sponge. Here you can see it in the collar sponge, okay? And here is a normal view of the kidney and the spleen. Okay, so one more time. Phased array probe, as you can see, you move it to check all the margins of the organs. In the posterior axial line, marker upwards to the bed and upper, more to the head than on the right side. And you can see the spleen, you can see the kidney. You have to find the view between the ribs, so you can move the probe just to get away from the ribs. And here is the collar, punch, kidney, spleen. So you move the probe to check all parts of the left kidney, to look for the Morrison to the collar sponge, and you can move it to the head of the patient to check for the pleura and the pleural cavity in the search of the fluid there. So if you train, if you practice, it's really not so difficult to obtain those views and to interpret them. And the last view from this original FAST examination, the pelvic view. Of course, as in previous situation, you use your convex or phase array transducer, and you should put it on the level of the symphysis pubic, and we can have two views, the horizontal axis and vertical axis. So when you would like to get this horizontal axis, you put a probe marker to the left, to the right side of the patient. And if you would like to get the vertical axis, the marker should be towards the head of the patient. Okay. So in this view, you can see the urinary bladder if it's empty or if it's full, and you search for the fluid around the bladder. Okay. You search it around the bladder. You can also search for, in males, vertical rectal recess, and in the females, pouch of Douglas, which is between the uterus and rectum. And we look for the blood in the pelvic cavity. Okay, so let's check how it looks when you use it normally. So you can see here the pelvis. That's so you put a probe with the marker to the right side of the patient over the symphysis pubic, and you can, that's what you see. So that's the female, so we can see here the bladder, the uterus. Okay, and you can move the probe in caudal and head direction to check all the structures. So the bladder, okay, and we look for the blood in this area. Okay, and then the vertical view. So we've got the bladder, and depending on the sex, the rectum or the uterus, and we search for the fluid in this position. Okay, so that was the original FAST examination.